Well, we have a new contributor this week for our Medical Minute feature. Dr. Jason Hazlett of Stepping Up Physical Therapy will be with us the first Monday of every month, so we're looking forward to that. Doctor, good to see you. Tell us, first of all, a little bit about your facility.
Sure. Well, it's called Stepping Up Physical Therapy. We're here in Fort Wayne. We have 4 different locations, one north, one all the way south. It's a new building on Calhoun and Rudisill, one southwest off Jefferson, and then one pretty far north, just north of Union Chapel.
All right, so you got a lot of areas covered that people can get convenient coverage. First of all, there's a lot of things, obviously, that you deal with. Today, we're going to kind of focus on shoulder pain. And what are some of the most common things you see, or what are the most common things that you hear about?
I think people think of rotator cuff issues most commonly, but usually they say it incorrectly. They say rotator cuff or rotary cuff. It's rotator cuff, C-U-F-F. And that can happen from an injury. Can happen from throwing injuries, but most commonly what we see in our clinic are people our age and older that the shoulder's just not working like it used to. Maybe they've been sitting at the computer too long and it's aggravating the shoulder, and they have a nagging pain that won't go away. And eventually they find they don't sleep well because if they sleep on that side, it wakes them up. That's what we typically see come in our office. It's probably the 3rd most common thing we see.
So it can affect you in a lot of different ways. What are some things that you can do? Like when would they come to you? What are the things you can do that can help that type of situation?
Usually they wait too long to come. So when they can't get their arm overhead, they can't reach behind their low back, they can't get the milk out of the fridge, that's when they come to us. If they could come to us before that, I'd prefer that. But the things that we do is we've got to figure out what's causing this injury. And oftentimes it comes back to posture and body mechanics. How are you using your arm? Keeping that elbow closer to your side when you go to pick up something like the milk is helpful. You and I talked about using a mouse before. If your mouse is up here on the desk and your elbow's up all day, your rotator cuff is kicking in all day as you use that mouse. So we help problem solve as well as get into treating the shoulder.
As far as like the impact, like because I've got that little thing where I just hit in a certain spot. I'm sure a lot of people have that.
The shoulder is a very mobile joint. There's a lot of things in there. Then there's 4 tendons plus a bursa that run underneath the protective bone, and that bone sometimes can have a little spur or a lip on it, and that can irritate things. And that's especially true if you're not using your shoulder correctly. We talked about your desk because your mouse is up here and your elbow's up there, and I think that this continued use is setting that off. So we would want to change that mouse position, get the elbow down to prevent that injury.
But see somebody before it gets too bad.
Right, right.
All right, very good. We appreciate that. Looking forward to seeing you on the first Monday of every month. Dr. Jason Hazlett. You can find much more about Stepping Up Physical Therapy by calling that number on your screen or visit steppinguppt.com.